I'm now joined by Will Lowrence to talk about the amendment to the CRPC guidelines this year. Will, first of all, welcome.
Thank you for having me.
Well, thanks very much for joining us. So let's kick right to it. So what is the amendment that we're talking about?
Yeah, so the main part of the amendment this year is focusing on the PREVAIL trial. It's the use of enzalutamide in men with metastatic castrate-resistant prostate cancer who have not received prior docetaxel. So this year the PREVAIL trial data were released actually in 2014. We've added it to the guidelines, so enzalutamide is now a treatment option for men with metastatic CRPC who have not received docetaxel chemotherapy.
One of the things that we find when we're walking around the place and we're talking to people is how important the AUA guidelines actually are. Well, what do you think differentiates the AUA guidelines?
Yeah, you make a great point. There are a lot of guidelines out there. We think that there's a ton of interest among urologists around the U.S. and the world for that matter in getting more involved with treating men with metastatic castrate-resistant prostate cancer. And the AUA guidelines, at least the feedback we get, are very user-friendly. They're based on 6 index cases or index patients that really represent the clinical scenarios you're going to see in treating these men. And I think our guidelines, as compared to maybe some of the other ones, do a really good job of highlighting these cases and then giving urologists good treatment options that are easy to interpret and follow.
You make a really good point about the practicality of things, and I mean, communication is important in all works of life, but particularly this, isn't it, and how you actually make sure that everybody follows the work that you guys are doing.
Absolutely, it is, and that's why we have a course here at the AUA. We're going to have a plenary session, and what the AUA Guideline Committee should be commended for, the AUA itself, is that they've supported doing an update of this guideline. We had one last year, another one this year, because this space is moving so rapidly that if you don't update it annually, the guideline's outdated. So.
Well, thanks very much indeed for joining us. We really appreciate it.
Great.
And best of luck with your work. Thank you.
Thank you very much for having me.